Recovery Reform is a podcast that provides educational content while addressing the stigma against drugs and the people who use them. Expertise meets lived experience as the hosts and their respective guests unpack the multifaceted cause that is recovery reform. What's up, y'all? Welcome to Recovery Reform. My name is McCauley Sexton.
And I'm Taylor Nichols.
Today, we're going to do an intro episode, so let's get right into it. Again, my name is McCauley Sexton. I'm a person in long-term recovery. I've been in this process for over a decade, and I'm someone who went through traditional treatment. I had an intervention. I did an inpatient stay for about 4 months. I did about 6 months in sober living, including intensive outpatient while seeing an addiction medicine professional. And yeah, I was like the poster boy of traditional recovery. I went to treatment one time, and I've been in recovery ever since. But after about 4.5 years in traditional recovery, and by traditional recovery, I mean 12-step recovery, my mental health was declining, and I was doing everything I was supposed to. I was going to the meetings and doing service work and working the steps, sponsoring, had a sponsor. And this was a rude awakening for me because I had worked really hard at traditional recovery. And that is why I started looking into alternatives, is because my mental health wasn't doing good. It was very rough. It got to the point to where I was experiencing suicidal ideation, actually. So that is where I dove headfirst into research and understanding what is out there, what is available for people suffering from substance use disorder, because I was only given one option. And I'm grateful for that option because I was able to utilize it. But when it came to long-term sustainability, it wasn't there for me. So I started to research alternatives, actually went on TikTok and started to hear from people who had different pathways. And I started to realize that my understanding was actually very limited. It was, and I had to deprogram from a lot of the limiting beliefs that I found. So that's where my passion for recovery reform came in, because I realized, hey, yeah, I made it through treatment and I made it through 12-step, but what about all of these other people that aren't? I had very ignorant takes on medication-assisted treatment. I didn't understand stigmatizing language and how it affected people. So I just want to be clear. This is me after years of working on a lot of the problematic ways of thinking and rhetoric that I would spread on a daily basis. And so I really just want to acknowledge that. Now, as far as what I do personally, my recovery is based on freedom. It's based on alternatives, utilizing alternatives. I have remained abstinent from opioids and benzos and alcohol and, illicit substances as a whole. But I started to realize that even just identifying with that necessarily wasn't helpful for me to even project that out there, or even the idea of abstinence at this point. So I'm an alternative treatment industry professional. So I do caretaking for people who are going through very alternative options, utilizing very alternative options rather. And I also make educational content. I've made educational content for the public school system. I do consulting with individuals experiencing substance use disorder and their families. I also work with people who are not looking for recovery and they just want to utilize harm reduction practices, tools, and protocols. So my recovery has taken a complete 180. And yeah, at this point, I'm really glad to connect here with Dr. Nichols, because we can really cover a lot of ground and just meet expertise and lived experience, medical and just purely subjective experience, and just combine these things and really, just touch on a lot of really important topics. So I'm gonna quit going on and on here, and I'm gonna give the floor to Dr. Nichols.
I'm Taylor Nichols. I'm an addiction medicine and emergency medicine physician in Northern California. And I did, like McCauley was just saying, it took a lot of unpacking of that stigma that I had internalized. I'm not a person with a substance use disorder, but I come from a long family history substance use disorder. I'm the child of someone with substance use disorder. And I had internalized a lot of that stigmatizing, harmful language of the traditional abstinence-only recovery spaces. And when I was an emergency medicine resident, I had to do a lot of that same deep work that was really uncomfortable, learning that really I had been wrong and I was projecting my own issues with, substance use disorder, and that could be harmful. That could be harmful to my patients. And seeing that and coming to that realization over time made me passionate about this and want to sort of share that experience. So I did medical school at UC Davis, and then I did residency in emergency medicine at UCSF and San Francisco General Hospital. And then if that wasn't enough, I did another year of training in fellowship in health policy and advocacy back at UC Davis. And now I currently work in emergency medicine in the emergency department and addiction medicine in sort of a multifaceted approach, trying to cover the continuum of care from the outpatient setting in a harm reduction clinic to the inpatient side, working on an addiction medicine consult service to ensure that we provide high quality evidence-based care to patients with substance use disorder who are hospitalized. And I work in the residential space as well with to make sure that we provide evidence-based medical care in the residential recovery space as well. I also work with our local street medicine team and make sure that we coordinate with them and provide adequate addiction medicine care to our street medicine folks and for our unsheltered homeless neighbors in our neighborhood. I'm really passionate about health systems reform, social and political determinants of health and health equity, and making sure that we provide evidence-based care and humanistic care with dignity and respect to all of our patients, and that includes people who use drugs. So that's really why McCauley and I sort of collaborated to make this podcast a reality and try to reform recovery and provide alternatives to what we see as a stigmatizing and ultimately harmful view of a single path to recovery in terms of the abstinence only model.
Yeah, thanks for that. Yeah, I think that it really comes down to we did it the wrong way when it came to our first attempts at advocacy. And so I think that is a very valuable experience. It is ultimately because we both were able to find our blind spots and address that. And so I appreciate that we have that shared lived experience. So we're going to briefly go into some of the topics of discussion here. First of all, we're going to be addressing substance use disorder.
Yeah. So what is it? What we reframe the term addiction because, we know that there is a neurobiological basis for the medical condition or disorder that is substance use disorder, that is addiction. So why does that language matter? Why does person first language matter, et cetera?
Then we're going into just stigma as a whole.
And how is that harming people who use drugs, people with substance use disorders, and patients who use drugs for treatment, such as for pain, whether acute or chronic pain, and how might that stigma also harm them?
Moving on, we have misinformation and myths.
Oh man, this isn't right in my wheelhouse, but perfect example of, like you cannot overdose from fentanyl by touching it. Just, we'll debunk that.
Next, we have the war on drugs.
What is that? How is that harming us and our communities? And that harms everyone, to be clear. And what are those policies from the war on drugs look like? What is that prohibition or prohibition-based policies? What does that mean?
Next, we have policy reform.
Yeah, how do we advocate, and how do we advocate to change policy or make policy better to support people who use drugs, or any policy change, frankly, but how can we reform policy to improve the system?
Next, we have harm reduction.
You know, this is a topic near and dear to my heart. I work in harm reduction. I love people who work in harm reduction spaces and all of the amazing work that they do. But let's talk about it. What is it? Why is it important?
Addiction medicine.
Obviously, this has been a path that I have chosen for my career, and I want to talk about like what is the evidence, because it is its own unique independent subspecialty, and what sort of evidence base do we have to like call it its own practice of medicine?
Next, we have understanding substance use disorder in emergency medicine.
Obviously, a topic super important to me. I do a lot of work in this space, trying to bridge the gap between emergency medicine and addiction medicine. And how can we provide better care to people who use drugs when they come to the emergency department?
Then we have evidence-based recovery.
Oh boy, this is a big topic with a lot to unpack. But what does evidence-based recovery mean? What is the evidence basis for the different paths to recovery? All recovery is valid. All paths to recovery are valid. But what are the different, what is the evidence that we have for each of those?
Next, we have medication-assisted treatment.
Along the same topic of evidence-based recovery, like what does medication-assisted treatment mean? What is that topic? And discussing the wording too, because I prefer the term medication for addiction treatment. But how did we get there? What is the language? What are the medications, and what's the evidence there?
Next, we have chronic pain and opioid use disorder.
This is a big topic with a lot to unpack, but talking a little bit about what is the difference between addiction versus dependency. Both communities are people who use opioids potentially. And how is that stigma harming both of them? What is the difference between those communities, or those sort of treatment modalities, and why is that important?
Next, we have the treatment industry.
That is such a huge topic with a lot to dive into there. But there's the treatment industry is broad. It's not as closely regulated as some other spaces in medicine, and there's a lot to think about in terms of ethics and the approaches that we take, and it relates directly back to evidence-based recovery, which we're going to talk about.
Yeah. Next, we have traditional abstinence-based recovery communities and problems such as misogyny and racism within these spaces.
This is such a important topic, and I think it'll be really an interesting conversation to have, and something that we really would welcome your input and your feedback, from the listeners. And if there's any other topics that you think we should cover, anything that you want to know more about, let us know. You can check out our website, recoveryreform.org, or reach us at recoveryreformpodcast@gmail.com. Recovery Reform will be available wherever you download your podcast, so be sure to leave a rating and review, subscribe, and we will see you next time.